Welcome to Scrub In, a podcast where purpose meets care. We are more than just a podcast. We are real stories of hope, expert health advice, and inspiring conversations with the people behind the scrubs.
This podcast will leave you informed, inspired, and reminded of the purpose that connects us all. It's the voice of humanity in healthcare, uplifting, honest, and full of heart.
Featuring hosts Dr. Kendall Barton, Keisha Morris, and Alice Roush. You can listen and subscribe on Apple Podcasts, Spotify, Google Play, and YouTube. Or visit bayhealth.org/scrubin to learn more. Now, let's scrub in. Here's our next episode.
Hello, and welcome to the latest episode of Scrub In. I'm Alice Roush, joined with Dr. Kendall Barton.
Excited to get going. We're going to jump in with things with our quote of the day. Your body is a map of your life. It stores your memories, your joys, your sorrows, your traumas. But it also holds the key to your healing. And that's by Bessel van der Kolk.
It's almost like we're going to talk about something to do with your mind.
I have a slight feeling we just may.
That is the episode topic today. We're talking about caring for your mind through the holidays and beyond. And today we're joined by Dr. Andrea DeSimone.
Awesome. Super happy to have you here, Dr. DeSimone. So thank you for joining us.
Yes, thank you for having me.
Yeah. Absolutely. And let's get started by learning a little bit about you. Tell us about yourself.
So I grew up in northern New Jersey, in Bergen County, and I went to college in Hamilton College in New York, and then to medical school in South Jersey. Went on to residency in Philadelphia at Thomas Jefferson University Hospital, and then up to fellowship in Boston at Brigham and Women's Hospital.
That's awesome.
Yeah.
And how long have you been at Bay Health?
About 4 years, a little over 4 years.
So happy to have you here.
Yeah.
So tell us a little bit about the why behind why you chose to get into medicine.
Well, it was mostly that I wanted to get into psychiatry, not necessarily medicine. So when I was in high school, I had a requirement in my Catholic high school to do community service hours. And my math teacher knew I was a swimmer and I was on the swim team. So she told me to get involved with special swim at the local YWCA. And she just thought this would be something that I would enjoy. And I really did. So I not only did my community service hours for freshman year, I did all of them for all 4 years of high school there, and found that I really enjoyed working with children and adults with special needs in the pool. And it wasn't just about the fact that they were learning to swim, which was a big thing for them, for sure. But it was also about them learning a new skill and what that meant for themselves as well as for their parents and their family. So I thought maybe, okay, I want to do psychology. Like this would be like some kind of developmental psychology thing that I wanted to do. So I went to college wanting to do that, and then I didn't really like it. So what I did was started to take some different classes, and I found that I really enjoyed my neuroscience classes. So I did an internship in a drug and alcohol rehab during one of the summers, and found that I couldn't really treat the mind without treating the body, because a lot of the patients had things like HIV, hepatitis C, and this was all influencing their life and their mental health. And I thought it was all connected. So I said, okay, I guess I have to go to medical school now. So I went into medical school wanting to do psychiatry.
That's great.
Yeah.
Wow, that's a great story.
I think most of us, when we think of psychiatrists, we think of going to a clinic and sitting on a couch and talking to someone. But for those of our listeners that don't know, you do most of your work in the hospital.
Yes.
Tell us how that's a little bit different from what people understand of outpatient.
Yes. Yeah, I think there's this stereotype of psychoanalysis as being the only type of psychiatry. It is one of them, but there are a lot of different types of psychiatry, and we fit into a lot of different places in medicine. So what I do is called consultation liaison psychiatry. It's a fancy word, but it used to be called psychosomatic medicine. And I think that maybe gives a better description of what I do to the average person. And so what CL psychiatry targets is the interaction between the mind and the body. So CL psychiatrists have specialized training in how the mind and the body interact, especially in patients who are admitted medically to the hospital. So I only see consults, I only work in the hospital, and so I am called specifically by primary teams, by hospitalists or surgeons who have a question about their patients and how it relates to psychiatry. So that is how I do my business in the hospital.
That's awesome. Yeah. Appreciate you filling us in on that.
Yeah.
So helpful.
So we've heard a little bit about you as a doctor. Tell us a little bit more about you as an individual.
Well, so there are a few things that I like to do outside of medicine. I have a few interests, but the first thing I think of is cooking. I love to cook. I love to read. I love to be outside. And so if I could do the reading and the outside part together, that's usually the best thing, best of both worlds. I like to be at the beach as well. And so that is something that definitely drew me to Delaware, is that I can be very close to a beach very quickly. So I love that. And then I like in the mornings, I do try to get a workout in. So that is something that keeps me grounded. It gets a lot of that, the kind of new day jitters out, and something I really enjoy doing.
We talked a little bit how you manage stress when you're not at work, but how do you bridge that gap between the balance between work and home?
Well, balance is a thing that I struggle with. This is, I think, one of the things that I find, I guess, frustrating about people's perceptions of psychiatrists is that I think people think that we have all the answers, that we have like somehow figured this out. We do not. Spoiler alert, we don't have all the answers. So this is something that I struggle with all the time. But what I have tried to do is I really do try to leave work at work. And some of that is leaving my work cell phone like right by my garage door, like the entrance to my garage. So like that's where it goes. After I come home, I try not to check it at all until the next morning when I'm on again. So I try to do that. In psychiatry, we are very well aware, and we learn from very early on in residency, really early on part of residency, that our patients will affect us. And if they don't, that is not normal. That's the not normal part, is to not be affected by your patients. So we learn very quickly that we need to be able to talk to people about this, whether it's colleagues, whether it's friends, family, whatever it is. When something's bothering us about a patient or our day, we need to talk about it and what it means.
It's a really good point, because I feel like a lot of people forget that there's a human behind the doctor sometimes.
Yes.
And when you're dealing with some very deep subjects with patients when it comes to their mental health, it can be tough and challenging. So I'm glad to hear that you've got your working it out still, as we all kind of are.
Yes.
Yeah. We know mental health is so important in our area and everywhere. And what are some steps that our patients can take to address their own mental health?
So the first thing I would suggest is that not letting it get to an emergency situation, that there is no shame in asking for help. And it sometimes is easier to obtain that help when it's a little bit earlier on. And I don't mean, that there will be an access issue later versus now. I don't mean that. I mean that if it's an emergency situation, we may not be able to get you seen so very quickly. So early action on a patient's part is much preferred, so we can help in that way. There are a lot of resources that we can tap into, even in places, which is the entire country really, where there is an access problem to mental health practitioners. We can do some of those things. It may just take longer. So I would say that the first thing is to start early.
Good. Is there anything you would tell our listeners who don't have a psychiatrist or a mental health provider now? Like, where do they start? And if they've got to wait 6 months, is there something that they can do in the meantime?
Well, Dr. Barton, it would be starting with their primary care doctor. I hope they have one. That's another podcast entirely about primary care access. But our primary care colleagues can do a whole lot in terms of referrals, as well as starting medications if necessary. So, and that's someone who they're seeing a lot of times much more than a specialist in any area of medicine. So that's the first person that they should go to, is their family doctor, their internist. And if they are worried about their child, their pediatrician.
Are there certain signs to look for that you might spot early, I guess, in a family member or even in yourself, that would be, oh, maybe I should take that action now?
Mm-hmm. So I guess the one of the first things that I want to establish when I'm seeing a new patient is, how is this affecting your life? And is this really affecting your life in a meaningful way? That's what we call in psychiatry is like a functional deficit. Is what you're experiencing getting in the way of you doing things that you want to do? And so that would be something that I would ask listeners to think about is something getting in your way of doing what you want to do. A lot of times, especially with things like weight loss or exercising more, eating better, we all know what we have to do, right? We all know the steps. It's not necessarily you need somebody to tell you what you need to do. There's something getting in the way of you doing those things, and that's when you want to engage somebody like a psychiatrist, a psychotherapist, psychologist, something like that.
That's awesome. Appreciate that. I'm
Yeah.
sure our listeners do as well. So during the holiday time, it can be particularly challenging for a lot of patients and listeners. What advice would you give them if they are actively looking for a mental health provider?
Yeah, so there are a lot of different avenues that patients can go down. So the first one is the easiest, maybe, is to call a number on the back of your insurance card if you have insurance. So that's number one, because your insurance company is required to provide you with psychiatric services. It's a part of medicine, so they are required to have somebody available for you. And it is a carve out, so that means you have a medical part of your insurance and you have a behavioral health part of your insurance. So they need to provide you with that. So you can call that number and ask for who is in your area that takes your insurance that you can call on. Employers will often have something like an employee assistance plan that employees can take advantage of. And a lot of times that comes with a set number of free sessions, whether that's coaching or counseling or things like that. That is a good resource to start. And that can at least get you in the door with somebody who can then send you to a community provider. And that's also quite helpful. In the state of Delaware, I'm not an expert in other states, but in the state of Delaware, there are 3 walk-in clinics for mental health services and substance use primarily, but they also take patients with substance use, and they're called the Bridge Clinics, and they're in each county. So in Kent County, it's in Dover, and then in Sussex County, it's in Georgetown, and patients can just walk in. So they are specifically designed for people who are underinsured or have no insurance, but patients can just walk in. I refer to them for patients, whether in the hospital, to just walk in, but that is also available. And then lastly, if you would like to find somebody on your own, you can go to psychologytoday.com and you can input your town or zip code, and it'll come up with a list of people in your area that both take insurance and who don't. So you can find cash pay providers on there as well.
Really helpful advice.
This might have been some of the best advice we've had on this show, so thank you for that. I know our listeners will be appreciative of that.
Just the simple look on the back of the card and call the number. I mean, how easy it is to overlook something like that. And it's so simple if you are in a pinch and you need to get help.
Yes.
That's great.
So you've mentioned a lot of terms like psychiatrist, psychologist, a behavioral health counselor. For our listeners that aren't sure what the differences are, can you help to educate them about what those services are provided by those unique specialists?
Sure. So a psychiatrist is a physician first and foremost. So they are a physician, they're a doctor whose specialty is psychiatry. So that's like when you see your cardiologist, that's a physician who has a specialty in heart medicine. So it's the same thing for psychiatrists. We're physicians first, and that should kind of be what you think about a psychiatrist. For a psychologist can have a doctorate. They a lot of times have a PhD or a PsyD. They are doctorally trained clinicians whose specialty is in talking therapy. So they are not able to prescribe medications, but they do talking therapy. Psychiatrists can do talking therapy as well as prescribe medications. There are other people who practice psychotherapy who are master's trained, and so those are clinical social workers. In the state of Delaware, we have something called an LPCMH or a marriage and family counselor. They are also able to see patients for psychotherapy, for talking therapy. So when you think of who you would like to see, I'm clearly biased. I want patients to see a psychiatrist because we can a lot of times steer patients to what would be best for them if we think that what they have is best treated with psychotherapy. Either we can do that ourselves or we can refer to somebody who we trust to do that. If medications are warranted and a patient is agreeable, we can do that as well. If you know that you don't want to take medications, you can go right to a non-prescribing person, like a psychologist or a psychotherapist, like a social worker. So it really depends on what your goals are. And it's okay if you don't know what that is going in. You can always regroup.
sort of leads into what's some practical advice you would give people for, how to handle their mental health?
So when I speak to patients, I generally say, I don't know exactly what's going to work for you. Mental health and mental wellness looks different to every single person. Somebody may be very happy working, 120 hours a week, and somebody else may loathe that. So it looks different to every single person. But when somebody asks me, I will say, well, just think about the basics. Are you eating well? Are you sleeping well? Are you functioning well? Are you loving well? So those are the things that I ask them. And so a lot of times the answers are no. I'm not eating well. I'm eating a lot of fast food. I'm eating a lot of prepared foods. I'm certainly not sleeping well. And so those are the kinds of things what's getting in the way of you doing those things? We all know that we need sleep. So what's getting in the way of you getting a good night's sleep? And sometimes that's something that I can help with, and sometimes it's something that somebody else can help with. Sometimes it may be something like, if somebody's having dialysis, this is where my specialty comes in, is knowing these kinds of things when speaking to a patient who's coming for a mental health concern. If somebody's going to dialysis 3 times a week, they may be very fatigued about half the time. So what medications can be prescribed in someone who's on dialysis? What kind of diet should they be eating? There can be all sorts of things that complicate the picture. But I tend to go back to basics: eating, sleeping, loving, functioning, working.
That's awesome. And I think one of the recent shifts in medicine is connecting the physical side to the mental side of medicine, and realizing that they're not two separate ships. They're the same boat.
Yes.
And, in order to treat one, you've got to take into consideration the other one. So I'm really happy to hear you say those things.
Yes.
Well, as we're in the midst of the holiday season, do you have any advice for people in dealing with just the stress of it all?
Yeah, the holidays, even though they are billed as a very happy and jolly time, can also be quite stressful. So the first thing I think of is setting boundaries with yourself and with other people, and whether that is very practical things, like I will set a budget for how much I spend, versus or something a little bit more abstract, like, maybe I don't go to as many holiday parties or things as I normally would. So it could be practical, could be more emotional, something like that. I also think about saying yes and no appropriately to things. A lot of people give very well-meaning advice and say, especially when I got out of training, it was, well, say yes to everything, do everything. Then very quickly, that doesn't work out so well. So then you have to start to learn how to say no to everything. And so you get these conflicting pieces of advice. And what really we need to focus in on is knowing when to say yes to things and knowing when to say no to things. And sometimes, people who are maybe more introverted, who tend to isolate a little bit around the holidays, need to maybe say yes to more things. But people who are more extroverted and who thrive on that maybe need to take it down a little bit and say no to something. So it's a little bit more about knowing yourself and what you need to say yes to, what you need to say no to. And then lastly, allowing for mixed feelings. That's like an appreciation of the fact that our life is not black and white. It's not all good. It's not all bad. Most of what we experience is somewhere in between those things. And so allowing that space for, this is a happy time of year, and also I can be sad. I have grief over people who are maybe not here. That's allowing you to have those mixed feelings is very special.
It's awesome.
Yeah.
I think one of the themes of what you've said during a lot of your information today is that everybody's unique, and one size does not fit all, especially when it comes to our mental health. So I think everybody has to understand that just something that works for some person or what makes them happy or sad doesn't necessarily apply to them.
Yes. Yeah, it is. That's something I think that sets psychiatry apart a little bit from the rest of medicine, because with something like diabetes, when you have it, when you don't have it. Hypertension, when you have it, when you don't have it. But with psychiatry, it becomes a little bit fuzzier, and it's something that is just a difference, and it's a difference in approach, because most of what we do in psychiatry is based on what the patient tells us. If somebody tells us that they I get consults all the time, like patient depressed, but patient may not say that they're depressed, and that may be okay for them, whatever they're experiencing. So I base a lot of how I want to treat patients is what they're telling me they're experiencing.
So knowing yourself is so important, and being able to be honest with yourself.
Absolutely. Well, thank you for sharing all of that. That's some amazing information, and I'm sure our listeners as well as ourselves are very appreciative of that. So thank you again.
Thank you for having me.
Absolutely. Thanks for listening to Scrub In, where we bring purpose and care to every conversation.
If you enjoyed today's podcast, don't forget to subscribe, rate, and review on Apple Podcasts, Spotify, and wherever you listen.
Stay connected, stay informed, and stay inspired right here with Scrub In.